Good morning, everyone. It's an exciting day. It's Magic Annual Conference Day, and we're just so excited that you're here with us. Magic is the state chapter of AGS and the Society for Post-Acute and Long-Term Care Medicine. It's our Minnesota Association of Geriatric-Inspired Clinicians. We're thrilled that you're here with us today to learn about best practice in geriatrics and help us continue to advance Magic's mission. Our organizational mission is to promote quality care through advocacy and education for aging adults and persons with complex health needs throughout Minnesota. To accomplish this, we need to become the recognized, prominent, and respected leader for aging adults and those with complex health needs in Minnesota. And our members are how we accomplish that, along with our supporters. We all know that seniors are in a position of significant need, and more seniors are becoming part of our community every day. If you had the opportunity to join our half-day session yesterday, we thank you. And this morning, we want to ensure that you know that Magic is a place of inclusion. Our organization stands with our community to promote equity, diversity, inclusion, and to combat systemic racism. I wanted to take a few moments just to highlight how Magic has been evolving over the past 3 years, because Magic has been going through some significant changes. 3 years ago, our organization was in a position where we really needed to make some tough decisions of how we could best, what our mission was and how we could best accomplish that mission. In 2018, we went through refining our bylaws that included expanding our membership and our board of directors. Since then, we've expanded our membership to include many, as well as nurse practitioners, physician's assistants, nurses, and anyone else, pharmacists, anyone else who aligns with our mission and vision. We've also expanded our board of directors, which now includes nurse practitioners, physician's assistants, and administrators. We also built our first website, and we hope that you visited our website, minnesotageriatrics.org. And we did refine our mission, vision, and our strategy. In 2019, we integrated a core community quality group, the Metro Alliance of Geriatric Providers, into Magic as the Magic Clinical Practice Alliance Committee. This committee, this group in our community, has been helping to define and standardize best practice for our seniors and facilities for nearly a decade. And to have the partnership with that group through Magic has just advanced our ability to serve our seniors. Last year in 2020, we had our first virtual conference, which was a huge success. And we also expanded our community advocacy efforts in response to the COVID-19 pandemic. Now I'm going to tell you a little bit about 2021 more specifically, what's been happening in Magic and what's next. So first, in terms of clinical excellence, the work of the Clinical Practice Alliance Committee has continued this year just as significantly as in previous years. Some of the key accomplishments under the leadership of Kelly Peterson are listed here. The committee produced a telehealth services toolkit, including best practices for implementation in congregate living facilities during the COVID-19 pandemic. We all remember now that providing services in person posed a challenge early in COVID-19. And those telehealth best practices have continued long into the pandemic and will beyond. Secondly, the committee has worked on considerations for using monoclonal antibody therapies and produced best practice recommendations for those living in congregate care settings. This really is helping to elevate the needs and challenges of monoclonal antibody administration and getting that therapy to facilities for those patients that we serve. Third, the committee produced provider and nursing management recommendations for COVID-19 to provide best practices for providers and nurses and how to best care for patients with COVID-19 in their facilities. Additionally, they produced the next iteration of the influenza protocol for recognition, diagnosis, and treatment and prophylaxis for use in skilled nursing facilities and assisted living facilities. This is an annual update and one that our community really values. And finally, developing next iterations of our standing orders for skilled nursing facilities. This is one of the longer standing projects from the CPAC and is another update annually that really helps our facilities to provide standardized best practice care. I want to talk a little bit about Magic and advocacy this year. And our advocacy has been in a few areas predominantly connected to COVID-19. And we've really been advocating and educating our community and advocating for science. If you haven't had the chance to view the Magic video on the COVID vaccines, we encourage you to do so. This is Simon Middle, one of the participants in the video. And this video really helps to share within facilities to communicate the science behind the vaccines and help dispel myths around the vaccines to encourage vaccination within our communities. One of the things we were really proud of from this vaccine video was the diversity, equity, and inclusion lens to really help communicate the information broadly across our community. We have a few important updates as well. We've hired a new executive director. Heidi Holste has joined us and has jumped in and also already been a significant contributor to our organization. We're excited for Heidi and her experience and what she will bring to Magic to help us achieve our mission and vision. She's worked with nonprofit membership organizations as executive director before, has had extensive experience as a nonprofit executive director in the service industry sector, board member, and has over 20 years of experience in government relations work at the state, federal, and local level. Heidi is a graduate of the University of Wisconsin River Falls, and Heidi lives in Rosemount with her husband, very active 3 daughters, and 2 dogs. We are absolutely thrilled to have Heidi with our organization. If you haven't had the chance to interact with Heidi yet, you will enjoy it when you do, and please reach out to her and congratulate her. I want to end with celebrating some of our members from some of the key work and accomplishments that our organization has done this past year. First, one of the products of the CPAC, considerations for use of monoclonal antibody therapy for the treatment of COVID-19 in congregate living settings. Dr. Sandy Turbs, Dr. Teresa McCarthy, and Dr. Roberta Myers were the chief authors for this tremendous work. This work is going to make a substantial impact in our communities. Second, as the primary authors of the Magic COVID vaccine video, Ali Romstead, Kelly Peterson, and Amanda Tufano. These members of our organization have made significant impact with their dedication to our communities and serving seniors in the best way possible. And finally, a tremendous thank you. Magic exists because of its members to serve our community. We look forward to continuing to partner with you in our organization to make our community a better place.